Hi, my name is Dr. Michael Bethrus, and welcome to our practice. At Center for Sight, we strive to achieve the very best results through a caring and customized approach using the very latest technologies. We feel that the privilege of caring for your eyes deserves our commitment to being with you through every step of your visual journey. Your vision is our vision. Refractive lens exchange is a type of refractive surgery during which a patient's lens is removed and replaced with a lens implant. This is an option for patients who are not good LASIK candidates or want more spectacle independence from reading glasses. This surgery is the same exact process as modern-day cataract surgery, a surgery which has a very long and proven success record. The lens implant power and style is customized to each person's visual needs. One of the many benefits of refractive lens exchange is that one will never need cataract surgery. At Center for Sight, we strive to educate our patients and recommend the lens technologies that will meet their individual visual goals. With that said, it is important to understand how light is bent into the eye. There are two structures in the eye that bend light. One is the cornea, and one is the lens. We'll be removing the lens out of the eye and placing a lens implant in its place. When we talk about astigmatism correction during surgery, we're talking about corneal astigmatism. For instance, if this is somebody's cornea, the light rays that enter into their eye are bent depending on the curvature of the cornea. When somebody has astigmatism, there are two main curves that bend the light into two different focal points. This separation creates blur. When we correct astigmatism at the time of surgery, we are not necessarily addressing the cornea, we are just compensating for it by placing a lens implant in the back of the eye, which then corrects the astigmatism. The light then comes in and is focused into one point because the lens implant is neutralizing the difference in the corneal curvatures. At Center for Sight, our surgical success is a result of our commitment to utilization of the best technologies, as well as recognition and treatment of disease states that adversely affect a surgical outcome. For instance, our dry eye clinic can optimize an otherwise irregular corneal surface prior to surgery to help achieve better vision and comfort. We also use intraoperative aberrometry. This technology measures the eye after the cataract has been removed. It is very useful for eyes that have had previous surgery, are very far or nearsighted, or have a lot of astigmatism. Enhanced distance option is ideal for patients who want freedom from glasses for activities such as driving, golfing, or watching TV. With this option, the lens implanted will be targeted for good distance vision in each eye. This option includes the correction of astigmatism and intraoperative aberrometry. Patients choosing this option will still need glasses for near vision. Our MonoVision option is ideal for patients who have successfully worn MonoVision contact lenses in the past and would like to continue this system. With this option, one eye is targeted for good distance and the other for good reading. This option includes the correction of astigmatism and intraoperative aberrometry. Patients choosing this option do not need glasses very often, but might for night driving or extended periods of reading. Our multifocal option is ideal for our patients who want the most freedom from glasses. At the time of surgery, a multifocal lens is implanted in order to give the best distance, intermediate, and near vision in each eye. This option includes the correction of astigmatism and intraoperative aberrometry. This option is good for patients who would like the least amount of dependence on glasses. Our light adjustable lens implant option offers our patients an opportunity to be actively involved in customizing their visual outcome. This technology allows for post-surgical fine-tuning of the lens implant power. It is an ideal option for patients that have had previous refractive surgery or for patients who are looking for the perfect vision. This option includes correction of astigmatism. When considering your surgical options, we understand that the information can be overwhelming. Please be reassured that with the aid of your lifestyle questionnaire and lens measurement exam, I will be able to guide you and recommend the best option to achieve your visual goals. At Center for Sight, we want you to feel confident and are with you every step of your visual journey.
When I came to Center for Sight, when I met with Dr. B, he laid out the differences between lens exchange and LASIK surgery, and I really gravitated very quickly towards the lens exchange surgery, just due for the long-lasting effects of it. I wouldn't have cataracts with it, and it would fix my vision, where LASIK doesn't always fix every part of that because I have multifocal lens put in. So I would still probably need readers if I use LASIKs. Within 1 day of the surgery, I was seeing almost perfectly. And within a week, I came in and I believe I had 20/15 vision. You know, anyone that's ever had contact lenses, especially in the beginning, know they have to really battle with putting them in the morning. So it would add 30 or 40 minutes to my day. And I absolutely despise doing that and getting up. Now I wake up, I see perfectly, and I'm just back to exactly where I was when I didn't have to wear glasses, and that's exactly what I wanted when I came to Center for Sight.